Good morning, Mr. S. My name is Camila. I'm your primary nurse here today. I'm here to examine your symptoms and to see what your symptoms are and to see if there's any issues. Before we continue, can I please get you to verify your first and last name, your date of birth?
My name is Danny S. My date of birth is July 10, 1963.
Okay, perfect. Before we start, do you need to use the bathroom to empty your bladder?
No, I don't.
Great. Other than that, how are you feeling today?
I'm feeling okay.
Okay. So before we do all our examination, what I would need you to do is ask you a few questions and you let me know. Okay. When did your symptoms start?
About 3 days ago.
Okay. So you mentioned that you have shortness of breath, you have upper extremity movement problems, and you have sore throat for the past 3 days. Um, have you come in contact with anyone who's not feeling well?
No, I
No?
haven't. No.
Okay, good. How about, are you allergic to anything?
No, I'm not.
No? Okay. Are you currently taking any medication that could include over-the-counter prescription or herbal remedies?
No.
No? Okay. And what about smoking? Do you smoke or
I don't.
vape?
No, I
No?
don't.
Okay, great. Do you have any history of emphysema or any other respiratory illnesses?
No.
No? Okay. So our examination today consists of some minor touching. I will be examining your nose, your ears, your mouth, your throat, your neck, your chest, your upper extremities, the skin, and then also your lungs. So I will be doing some minor touching, and you're okay with that?
Yeah, that's fine.
Okay, perfect. So first we will start with your ears. Your ears seems symmetrical, and I don't see any lesions. I don't see any discharge, which is good. The next thing I will do is I will quickly palpate, and you let me know if you have any pain or any tenderness, okay?
Okay.
I would wear gloves for this examination, but I don't have a glove handy right now. I will sanitize my hand and we will do the process. So right now I'm examining your entire ear, auricles, and then the tragus. Do you have any pain?
No.
Okay, great. And then there's no tenderness, no pain. The next thing we will do is I will do a quick hearing test. I will whisper three words in each ear and you repeat after me, okay?
Okay. Chair. Fame. Chair.
Okay, that's great.
Table. Table. Phone.
Okay, perfect. That's good. The next thing I will do is I will examine your ears, your tympanic membrane, and your external auditory canal, okay? Okay, so I'm just going to lift your pinna. Okay, your external auditory canal is pinkish in color. I don't see any lesions. I don't see any foreign bodies, and I don't see any swelling. That is good. Now I will examine your tympanic membrane, which is pearly gray. There is no swelling, there's no edema, there is no lesions, which is good. The next thing I will do is I will quickly examine your nose. Your nose is symmetrical to your face, and I don't see any dryness, I don't see any lesions. There is no involuntary movement. I will quickly examine the inner side of your nose. Okay, so your nose is, nasal septum is midline. There is no lesions. It's pinkish in color, and there is no edema, which is good. The next thing I will do is I will quickly examine your sinuses, the frontal sinuses and your maxillary sinuses, okay?
Okay.
And then you let me know if you have any pain or any tenderness. Okay, do you have any pain right now?
No.
Okay, perfect. So your skin seems intact. We don't have any lesions, and the temperature seems fine. And the next thing we will do is a quick examination of your mouth. We will begin with your lips. Your lips are pinkish in color. There is no chips. There is no lesions. There is no swelling. There is no bleeding, which is a good sign. And your lips seems well hydrated. There's no dryness. And the next thing I will do is if you can open your mouth for me. Just go like this. Perfect. So I can see your gum is intact. It's pinkish in color. And I don't see any bleeding. I don't see any lesions. Your teeth are white. I don't see any cavities. If you can open your mouth for me. Okay. Just put your tongue down. Okay, perfect. So I don't see any cavities and there's no discoloration on your teeth. Your soft palate is pinkish in color and hard palate is whitish in color. And what I need you to do is if you can say ah for me. Okay, perfect. And your uvula moved and we just examined your cranial nerve 9. So that is good. The next thing I need you to do is just move your tongue side to side. Okay, perfect. So that was examining your cranial nerve 12 and it's intact. Can you say dynamite?
Dynamite.
Right.
Right.
Okay, perfect. So you're able to say those words. And then the other thing I need you to do is if you can smell this for me. Okay.
Smells minty.
Okay, perfect. And also if you can, okay, so if you, let me see, your lips are fine. Okay, so the next thing we will do is we will quickly examine your neck. I will start with examining your neck. So your neck is symmetrical and your trachea is midline and I don't see any scars. I don't see any, there is no visible masses and there is no lesions. Now I will quickly palpate your carotid arteries and you let me know if you have any pain or any tenderness, okay? Okay, you're good?
Mm-hmm.
Okay, perfect. And now what I will do is I need you to move your head from side to side and I will place my hands on your shoulder and you just shrug it against my hand, okay? So move your head side to side.
Like that?
Yeah. Okay, perfect. Okay, great. So that's good. We don't see any involuntary movement. Your skin seems intact. The temperature is fine. So we will have a quick examination of your upper extremities and integumentary system to see if we can do any abnormal findings. I can see that your shoulder is symmetrical and your skin is intact. The temperature seems good and you don't have any scars. You don't have any, I don't see any visible masses. I will quickly palpate your upper extremities. I will also check your muscles and your joints and you let me know if you feel any pain, okay?
Okay.
Okay, you're good?
Mm-hmm.
Okay, great. Okay, so what I need you to do is, if you can move your fingers for me. Great. And your wrist, your elbow. Great. And your shoulders. And then just put it side to side. Do you have any pain right now by doing that?
No.
No? Okay. So let me just feel that one more time. Okay, so your movement seems okay. I don't see any visible masses. Your temperature is fine, and there is no scars, and I don't see any involuntary movement of your muscles. So that seems intact. The last thing we will do is I will examine your chest and your lungs, and I will also hear your lung sounds, okay? All right. Okay, so the first thing I need you to do is I will palpate your bronchioles, and then we will go to bronchiovesicular, the three sounds, and then the last one we will do is your lungs, your vesicular, okay?
Okay.
Okay, so you just take a deep breath for me. Okay, lift up your head, please. Okay, perfect. So I can see that you have equal expansion of your chest. So the sound for your bronchiole is a little harsh. It's very hard because they're tubular, but I do not hear any wheezing or any other sounds or any crackles, which is good. Now I will do a quick examination of your bronchiovesicular, so which is right about your first and second intercostals. Okay, take a deep breath for me. Okay, perfect. So the sound for your bronchiovesicular is a little bit lower than your bronchioles. It's in medium, it's medium, and there is equal distribution of inspiration and expiration. You have, I do not hear any wheezing or any crackles, which is good, and your lungs are moving equally. The last thing we will do is we will do a vesicular examination, which is examination of your lung, okay?
Okay.
Okay, deep breath. Okay, perfect. So the sound for your vesicular is a lot lower. I can see that all lobes of your lung are distributed with equal air, and I don't. Your inspiration is a lot slower than your expiration, and I don't feel or hear any wheezing or crackles, which is a good sign. The last thing we will do is I will quickly do an exam of your tactile phremitis. As soon as I press my thumb against you, you just take a deep breath, okay? Okay, one more. Okay, perfect. So that seems good. Equal expansion of your chest. So I will document all the findings and I will let the doctor know, and the doctor will contact you soon, okay?
Thank you.
Thank you so much. Do you have any questions for me before
No,
I
I'm
leave?
done.
No?
Yeah.
Okay, great.